Hi everyone, welcome to Fifth International Fusion Conference on Science, Engineering and Technology. It's a pleasure to be here today. My name is Zeynep and I will be discussing agglomerative effect of alpha-lipoic acid on pancreas in valproic acid-induced toxicity. Valproic acid is a broad-spectrum antiepileptic drug and is usually well tolerated, but rare serious complication may occur in some patients receiving valproic acid chronically, including hemorrhagic pancreatitis, bone marrow suppression, valproic acid-induced hepatotoxicity, and valproic acid-induced hyperammonemic encephalopathy. Valproic acid, also known chemically as 2-propylpentatoic acid or 2-propylvaleric acid. This compound is an aliphatic carboxylic acid containing a carboxylic acid group. Valproic acid is an effective and widely used drug in the treatment of anxiety disorders, bipolar disorders, migraines, and epileptic disease. Many studies report that long-term use of valproic acid is associated with side effects such as pancreatitis, liver toxicity, skin rash, and tremor. Valproic acid can use tissue and organ damage by increasing the production of free radicals. Alpha-lipoic acid is a potent antioxidant that prevents the effects of free radicals. It suppresses reactive oxygen species and prevents oxidative stress. These sites and toxic effects on various tissues and organs can be numbered as heart, spleen, small intestine, liver, muscle, and pancreas. Alpha-lipoic acid is a patent antioxidant that plays numerous roles in human health. Alpha-lipoic acid is a naturally occurring diethyl compound. It's synthesized from octanoic acid in the mitochondria. Alpha-lipoic acid has two forms, an oxidized form and reduced form. Alpha-lipoic acid improves endothelial function in patients with type 2 diabetes, Alzheimer's disease, and other conditions. Besides, the role of alpha-lipoic acid as a potent antioxidant is also acts as an inducer of endogenous antioxidant production. Moreover, it has a protective effect on hepatic and pancreatic injury. It is safe to be administered during pregnancy, and no adverse effect was reported in mothers or newborn. The pancreas in animal, much like in humans, plays a vital role in digestion and blood sugar regulation. It is an elongated gland located near to stomach and small intestine. The pancreas has both endocrine and exocrine functions. In animals, the size and complexity of the pancreas can vary depending on factors such as diet and digestive physiology. For example, in carnivorous animals, the pancreas may produce more proteolytic enzymes to aid in the digestion of meat, while in herbivores, there may be a greater emphasis on producing enzymes to digest plant matter. Although the pancreas plays a crucial role in maintaining proper digestion and metabolic balance in animals. In this study, we aim to investigate the agglomerative effect of alpha-lipoic acid on valproic acid-induced toxicity in the rat pancreas. Group 1 is the control group. Group 2 receiving only alpha-lipoic acid daily for 15 days. Group 3 receiving only valproic acid daily for 15 days. Group 4 receiving valproic acid plus alpha-lipoic acid at the same dose and duration. The experimental produce was applied for 15 days. After one night of fasting, all rats were sacrificed under anesthesia on the 16 days. The pancreas tissues were taken. This slide shows the parameters we examined. There are total antioxidant capacity, total oxidant status, reactive oxygen species, sialic acid, and total protein. Statistical analysis of biochemical results was performed via GraphPad Prism 9.0. The total antioxidant capacity levels of all groups are shown in figure 3. Total antioxidant capacity levels were significantly decreased in valproic acid group as compared to control group. Alpha-lipoic acid administration significantly increased the total antioxidant capacity levels of the valproic acid plus alpha-lipoic acid group when compared to valproic acid group. The total oxidant status levels of all groups were figured out in figure 4. Total oxidant status levels were significantly increased in valproic acid group as compared to control group. Alpha-lipoic acid administration significantly decreased to the total oxidant status levels of the valproic acid plus alpha-lipoic acid group compared to valproic acid group. The reactive oxygen species levels of all groups are seen in figure 5. Reactive oxygen species levels were significantly increased in the valproic acid group as compared to the control group. Alpha-lipoic acid administration significantly reduced the reactive oxygen species levels of the valproic acid plus alpha-lipoic acid group compared to the valproic acid group. The sialic acid levels of all groups are shown in figure 6. The sialic acid levels were significantly increased in the valproic acid group compared to the control group. Alpha-lipoic acid administrations significantly reduced the sialic acid levels of the valproic acid plus alpha-lipoic acid group as comparing to valproic acid group. In supernatants, total antioxidant capacity levels were decreased and total oxidant status, reactive oxygen species, and sialic acid levels were increased in valproic acid group. Administrations of alpha-lipoic acid reversed these levels in valproic acid group. According to the obtained results, alpha-lipoic acid showed its protective effect on valproic acid-induced pancreatic damage. This slide shows the references. This was two. Thanks for your attention.